Hey everyone, I know you're going to enjoy this episode. It's another interview with an amazing powerhouse physician entrepreneur. Her name is Dr. Renee Dua. She's one of the co-founders of a company called Heal, which is an on-demand mobile app. You might have heard about it if it's in your city. She went on to found another company called HeyRenee. It's an app that delivers generic medications to you, plus a personal health assistant. You're going to find all about her journey from beginning, from just practicing to starting all these major businesses, being a physician entrepreneur. I know you're going to enjoy. Thanks. Welcome to the Passive Income MD podcast, where we talk about creating your ideal life through multiple streams of income. I'm your host, Peter Kim. If you enjoy hearing about this stuff, make sure to hit subscribe so I can bring it to you every week. Now let's get on with the show. This is going to be an amazing interview. I have Dr. Renee Dua here. She's an amazing physician entrepreneur. She created this company called HeyRenee based on her 15 years of experience as a practicing nephrologist. She's been in service as a chief of medicine at two of LA's largest hospitals. And for 7 years, she was the CMO, the chief medical officer at a company called Heal, during which time she oversaw the successful delivery of over 300,000 house calls. Now, with her new company, HeyRenee, she's raised millions of dollars to help underserved chronic disease patients really follow their doctor's care plan towards living happier, healthier lives. She's also the mother of 3 children who are pride and joy. And in her rare free time, which we'll talk about that, she cooks, she takes long drives with her husband, Dr. Nick Desai. So, Renee, how are you doing?
Oh, great. Thanks so much for having me.
I'm super excited to talk to you because I've heard about HeyRenee. I've obviously heard about Heal. We're going to be talking about all these things, but I don't think I did HeyRenee enough justice. Do you mind sharing a little bit about what is HeyRenee and what is it?
Certainly. So, we're all aware that there's tons of money being poured into what we call health tech at the moment, right? We understood, and we knew well before COVID, but we understood that many people do not have access to care. COVID shone a light on that. But the fact is, we're right now expecting patients to get a lot of tasks done with not a lot of coordination in those tasks. So every time a patient gets seen, the doctor lists 4 things to get done. Our job at HeyRenee is to automate some of those things. In other words, I don't expect a patient to log into an app to get their medications delivered, log into a separate one to get their vitals checked, log into a separate one to get their mental health provider to see them, log into another one to get their care plan, right? My anticipation, and certainly on the HeyRenee platform, is we'll put all of it together, right? Patient's care plan is there. We get their vitals. We manage their medication, reminders and deliveries. We check in on their mental health. Hey, maybe they need a ride to get to one of these appointments. We schedule it, right? Everything's in one place. I actually, hilariously would, of course, never name anything after myself, right? My husband did that. And the reason he did is I have a daughter and a caretaker. And my father and my mother, who I take care of, say, "Hey, Renee, I have to get my X, Y, and Z test done. Can you help me?" Or, "Hey, Renee, can you give me the results of my X, Y, and Z test?" And so I'm HeyRenee for them. I put it all together for them and give it to them in a format that they can understand. And they're doing really well, right?
I mean, I think physicians, we can all relate to that story of our family just asking us for things. "Hey, Renee, hey, Peter,
Our patients.
Patients too.
Right? I mean, I am a practicing doctor, and I have to tell you, I feel so much for my patients. They sit in my office and I give them those lists of 4 things, and I'll be damned if they come back having done 2. Right? It's not their fault. Somebody has to bring the whole picture together. And it's a huge hole. And the other part of it is so much is expected of us doctors, right? I find it astounding every time an administrator, see more patients, close more care gaps, HEDIS, this and that, chart, one of these administrators has to come and sit and see what it's like in a doctor's office. It's outrageous. And so there's a massive ask on doctors. There's data bloat. They're being, pulled in 1,000 different directions. We want to be the back office, right? We'll do all the jobs that you theoretically cannot get done, but your patient will get those tasks done and you'll actually be included in that process, right? That's part of what we'll offer on the platform. So it's super exciting to me, both as a caretaker and as a doctor, right?
I mean, that's so cool. I mean, obviously, you've served as a chief medical officer or chief of medicine at a bunch of different hospitals. Was this always in the plan early on for you when you were coming up in training and your education to launch a big healthcare tech platform? How'd that
Such a
work
good
out?
question. The credit goes to my husband. You know, What- when I first met my husband, I was on an ER panel because I was growing my own private practice. And we went to a Dodger game. And I'm telling you, I got paged every 5 minutes for the entirety of that game. And he just looked at me and he was like, "Is this our life? Right? Is this what we're going to do? How are we going to have kids? You can't be in all these places at once." And I'm an old fashioned doctor. My patients really are very important to me, right? I think about them all the time, even if I can't practice full time medicine, right? So he took me on this journey of starting a company after a very scary experience with one of our sons. And it turns out I was pretty good at thinking through products and strategizing what doctors need, what patients should have. I became a patient as a mother. That's really what turned the light on for me. I was, you know, maybe yammering what I wanted my patients to do. But when I became a patient, it really created a whole host of, empathetic provisions in this little brain, right? And so that's what led me on the journey. Like every entrepreneur solving a problem.
I mean, I know that the early part of the journey included being chief medical officer at a company called Heal. Like, what did that look like for you on a day to day basis, and how are you balancing that with like your clinical work?
So Heal was another child for me, right? That's how much I loved it. That's how much I poured into it. And I started Heal after this very scary experience having children. And we scaled Heal, and the work I feel that we did there was tremendous. We scaled Heal into 12 states and we put $200 million of invested capital in it. Heal, though, to be clear, was started 8 years ago, way before a pandemic. And our vision was to deliver primary care in the home using software. So while everybody and their mom is doing that now, 8 years ago, investors and hospitals and patients were like, "This is weird. You come to our house with a tablet and you bring all this stuff and you'll take care of my kids and my grandma." Like, what? You know? Now we had some great success, especially in Orange County and Los Angeles and, New York, right? But it wasn't until the pandemic where I think all this money that's gone into health tech has really found its home in these wild and crazy, awesome ideas to get out of the way between doctor and patient, right? I think that to me is the most fulfilling part of the work I did at Heal. Doctors were looking at their patients on video telemedicine or their remote monitoring data. And maybe even in their living room couch and were like, "I'm here for you." And I was like, mind blown that we could actually pull something like that off.
So you guys built Heal over those years. You helped grow it. And then, now you have Hey Renee. Like, why even pivot to this? Why focus on even something new?
Yeah. So when I just left Heal in the last year, it was really because it's in an operational phase. It's growing. It's doing very well. And frankly, it was in such a place that enough was automated that I didn't need to be there as much for day-to-day operations in my mind, right? But I wanted to continue to work on this problem of getting out of the way of the doctor-patient relationship, right? And in my mind, what isn't happening right now is this bottom-up approach where you take this patient in your hand to hand combat, get done what they need to stay home and stay well, right? A doctor has her responsibilities, a payer or a hospital system, some of their responsibilities are a bit perverse in my mind, right? They're worried about money and churn and, I get it. But for patients, who's thinking about them, right? Who's thinking about their caretakers? Who's thinking about the fact that we're not going to have that many doctors and nurses and caretakers? A lot of this needs to be solved with software. And that's the next problem, the next evolution of a problem I wanted to solve.
So you have this idea and you want to do this. And there's a lot of doctors who are watching this who have they've had these ideas, right? This
Yeah,
could be improved.
for
This could,
sure.
like, what was the first step for you? Like, how did you know even how to get that started and to translate that ultimately get to a real product? But what was that initial early steps that you could kind of share with people?
The first and most important step was I had a partner who knew how to raise money, right? Because there are many ideas and many of them are great ideas, but you're not going anywhere until you have some money in the bank. And you could even use your own. In the beginning, we used our own. In the beginning of HeyRenee, we used our own, right? But you then need to scale. Once that idea gets cooking and going, you've put in the hard work, you need to scale. When we started Heal, we had a little bit of money, right? And Nick, my husband, who was our CEO, and I would do the house calls, right? Or we would go to the farmer's market and we would take people's blood pressures and bring balloons, right? So we did the grassroots approach, but then we needed to have money to scale. And that's where it becomes very important to have the right partner, if unless, maybe you know how to do it yourself, but the right partner to help you grow that business.
I mean, how's it in that room when you're talking to venture capitalists and you're trying to raise millions of dollars for this type of thing? Being a doctor in that room, like, how does that make you feel? Because we don't have that background with finance, with business. What does it feel like in there?
It's not always positive, right? It's not always positive. I've been in VC meetings where people have turned to my husband and been like, Dr. Dua, it's so great to meet you. And I'm like, do not use the internet, like do a little diligence, right?
I know.
But, there's also the, doctors I think have become a part of the system. So they don't garner the same respect that maybe like my parents who are both doctors, they were kings roaming the hallways of the hospital. So I don't think it's always positive. Doctors have really lost a lot of that importance and respect, which of course you can see on my face, I hate to see. On the other hand, we know something that people don't know, right? We know wellness. We know how to keep people well. And I dare any venture capitalist to solve problems on their own health without a doctor, right? So it's really important when we are in these meetings and we are trying to raise money that we remember we have a skill set that the folks in the room simply don't have. And a lot of doctors were humble, we're kind of quiet. We stay on the down low. You can't be that way when you're trying to impress people, right? It's weird for us, but you got to open your mouth and say what's good about what you do know and what you can do.
I mean, now that you're in this world of entrepreneurship, you probably come across other doctors doing other types of really cool stuff. What do you think the potential is for doctors to enter this space and the opportunity that's there for people who have ideas to make things happen? What does that look like in terms of that market and opportunities?
Huge. It is huge. Doctors, we're a limited number. We are very smart. We are very thoughtful. We are very compassionate. The healthcare industry, let's call it, is suffering from trust issues, right? We need to be the face of that trust. We need to be the face of that data and that acquisition of data and aggregating that data. There are so many things we can do, especially when we band together. Most doctors work for somebody now, but even if you work for somebody and while you work for yourself, it's important that you stand up and do the right thing. Do what's right for the patient, right? You will always be rich. And that's part of how we all, in my mind, can have such an impact.
Mm. And what does your life look like today? Are you still practicing? And I think you are in terms of clinical medicine. And how do you balance that between, being a mother as well, like you mentioned, working on your business, doing all this? Like, how do you make that happen?
So let me be very clear. I have an enormous amount of help, right? I have a wonderful partner and a husband. Our parents are still with us. I have a nanny. I have a nanny at night when I need it, right? I am tired. I'm not going to sit here and, tell you I'm the most well-rested person on your panels. But the thing there's that old saying, right? When you love what you do, it's not a job, it's not work. And I love it. And I see the impact of what I do. And, I see the impact of what I do on my children, right? Before we started this call, my little girl was in here. She was saying hi to the person on Zoom, right? She's fixing her hair, getting ready. I mean, this is going to be the way we're talking. This is going to be her life. And if, she becomes a doctor one day, and it would be such a privilege to see that, I hope she does the same things, right? To better our world, to better our patients' world, right? So it's in the end, it's worth it.
That's awesome. I mean, how important do you think it is for doctors, though, to try to, reach out or create these, alternative type of things? Is this for everyone? Is this for only some people?
Yes.
How should doctors be thinking about this?
It's not for everyone. Doctors work hard. I know how hard doctors work. And, They have to respect their own life balance. They have to respect their own mental health. And so, no, it's not for everyone. It is for someone that has a voice, that wants to command an idea, that, is able to do things outside of their time seeing patients that they truly enjoy and they don't feel, impresses pressure or distaste or dislike, right? So I don't think it's for everyone. Again, I also do think many doctors who are, typically wonderful people can find partners to help them grow a great idea if they can't do it all themselves.
Mm. Now that you've been here and you've been balancing all these things, like people see where you're at and they're like, oh my goodness, like she made it this far. Probably haven't seen a lot of the challenges that you've had to pass or go
Right.
through, or the obstacles you've had to hurdle. What are some of those things that you had to get through to get where you're at that people might be interested to hear about?
Certainly. And for that question, the true answer, we need an extension of our time together,
Yeah,
right? And
yeah.
lots of mistakes, lots of, maybe I should have planned that better. Lots of missing out on opportunities, right? Like I don't go to every Thanksgiving parade for the kids. I maybe don't take as many vacations as I'd love. Lots of no. If I had a nickel for every time a person said no to me, I would be very, very rich, right? So the lots of rejection. And again, rejection is not for everybody. So there are lots of negatives, but again, I'm always on the next corner waiting to see what happens. And suddenly something comes through, you know?
Mm. Where do you see this going? And I mean, you guys, what stage exactly are you at with Hey Renee? And where do you see
Sure.
it going the next 3 to 5 years?
Yeah. So HeyRenee has $8 million in seed funding, which means we don't have a product live yet, which is pretty cool, a pretty exciting stage of a company. In the next couple of weeks here, we're going to have what's called our minimum viable product. So it will be the easiest parts, the lowest hanging fruits of what we could do, but with a promise to deliver improvements in the patient care task management aspects that we described. Now, what we hope to do, and certainly in the next year, what we will do is grow the company with that money, right? We will deliver this service to patients and caretakers, and we will build automation, right? And predictions to how we can help them without so much human support.
I mean, now that you come along this journey, obviously it wasn't part of your story early on, but you saw the opportunities, you took them, you're solving problems, you're knocking these things down. After doing all this, like, how does it feel to look back, knowing that you have all these different things? As a physician, you wear many hats. How does that feel for you?
I mean, again, I just love it, right? I live my life not taking it for granted. I get up every day and I think I do something interesting. I do not wait for life to come to me. I grab the bull by the horns. And I'm not saying that's for everybody, but I'm saying that when I was, in the process of deciding to be a doctor, it was never in my mind to just see patients. I wanted to be a part of a patient story, and I knew I was going to be a patient. So I wanted to be a part of improving that whole series of events.
I mean, it's so cool. I know that people are going to be watching this. I mean, they're going to hear this story. They're going to want to know more about Hey Renee, but they also want to connect with you in some way. What's the best place for people to do that and find out more
Well,
about your company?
certainly. I'd love to hear from anybody, that would be excited to know more. So my email is really the fastest way. It's RENEE at heyrenee.co.
All right, we'll have that. And we also have the Hey Renee there. You have that nice sign for us back there. So it's
Yeah.
easy for people to remember.
Yeah. Make
Um,
the heyrenee dot com will
Self
be live.
CO, right?
Yeah. That heyrenee.com actually will literally be live tomorrow. We just got the boom. It's boom.
That's awesome. I was ahead of the game. I knew it was coming.
You're
So,
right on time. Right on time.
all right. Well, congrats on that. I really appreciate your time. Obviously, you're extremely busy, but you're doing amazing work out there. Before we leave people with, for this interview, you might share a tip for someone who wants to, first follow in your footsteps, create a company, follow through on a passion or idea.
So my tip is actually to sit down and make a plan for how you see that company growing, right? How do you see a path from your idea to making money or growing? Maybe it's not making money yet, right? That's tip one. And then I'll just add a second tip. If it's not you, who's the partner that's going to help you scale that idea into a reality, right? Because it's probably a great idea. It's probably a great vision. You need to put rubber to road.
All right. That is so amazing. Congrats on all the amazing work that you've,
Thank you so
accomplished so far. I know your story's not finished yet, right?
much.
I'll be able to interview you again sometime soon and just,
that.
yeah, and see kind of where this absolutely goes. I want to thank you for all the amazing work you do for people and just being a great example of what's possible out there in terms of, being a physician, wearing different hats. It's so cool to hear. So congrats on all that. And
Enjoy the show.
good luck with
Let me
with
know
the
by
launch,
dropping a
and let's
review
talk
in
again
the
soon.
podcast app
All
you're
right.
listening
Talk
to
more
us
soon.
in.
Bye-bye.
If you haven't already, make sure to hit subscribe. Are you part of our community yet? Join thousands of physicians who are also on this journey to creating their ideal lives through multiple streams of income. You can join us on our Facebook group, Passive Income Docs, and you can always learn more at our website, passiveincomemd.com. Thanks again for allowing me to be a part of your journey. See you next time.